Formed in 1988, IAS, the International AIDS Society, plays a crucial role in uniting the global HIV response. Its aim is to ensure that HIV remains a top priority in global health. We spoke to IAS President Dr. Beatriz Grinsztejn from her office in Brazil.
Beatriz Grinsztejn, President of the International AIDS Society, thanks very much for joining us.
Thanks very much for having me.
The IAS say that progress happens when science, policy and activism come together. How do you make this happen?
So since 1985, the IAS has been uniting the HIV response at the conferences it organizes, bringing together scientists, policymakers, and activists. Our HIV programs work with all stakeholders in the HIV response to close scientific gaps, disseminate the latest research, and improve health services. Our programmatic work ranges from promoting HIV vaccine, HIV cure, pediatric research, prevention research. And also we provide technical support to countries to increase the adoption of person-centered, stigma-free, and differentiated services. We also have the IAS Educational Fund. We organize small meetings in places where our conferences don't get to, and people from these places sometimes cannot come to our conferences. So through this variety of activities, we bring together science, policy, and activism in all of them.
Let's take the science part of that. How far has it advanced in the past 10 years or so?
Yes, over the past decade, we have witnessed incredible advancements in HIV science, shifting us into a phase of truly game-changing breakthroughs. It means that people living with HIV who are on treatment and maintain an undetectable viral load cannot sexually transmit the virus. This breakthrough not only reshapes public understanding of HIV, but it's also crucial in reducing stigma, offering a powerful narrative to re-engage those who have interrupted treatment. But despite these scientific strides, the big issue today is access to the latest innovations in treatment, care, and prevention. It is the biggest topic under discussion today is access. We have products that can really be game-changing in the reshaping the HIV epidemic. But we really need to seriously discuss access. So what we need now is to make these game-changing technologies really get to those most in need. And unfortunately, we still don't see it happening.
Now, you're based in Brazil, where policy and activism might be very different from elsewhere. Is it difficult to get the messaging right?
I think that we need to have universal principles like equity, human rights, and access to healthcare guide the global HIV response. So effective communication fosters understanding and engagement in diverse communities. Of course, it is different according to the place where you are. As an example, in Africa, you really need to pay a lot of attention on integration of HIV and other health services, reproductive health services, tuberculosis, family planning. So you need to adjust your messaging wherever you are. Governments and healthcare providers must unite with civil society groups to ensure that messaging is inclusive and effective.
You've devoted your career to HIV and AIDS care and research. So why is World AIDS Day so important to you personally and the IAS?
Yeah, so for the IAS, World AIDS Day is crucial because it brings attention to the ongoing need to unite science, policy, and activism to reach everyone. World AIDS Day is a moment to reflect on how far we have come in the response and address ongoing issues and structural inequities that still fuel the epidemic, like LGBTQ+ phobia, racism, and limited access to healthcare. Having started my career as the HIV epidemic emerged in Brazil, I am deeply committed to both the medical and social aspects of this mission. Stigma and discrimination remain significant challenges, as do laws that criminalize same-sex relationships, drug use, and sex work. which increase vulnerability and block access to healthcare. Key populations need support, not punishment. World AIDS Day is a reminder that we need to unite to ensure that no one is left behind. Only then we can ensure a just and inclusive future for the next generations.
Beatriz Grinsztejn, President of the International AIDS Society, thank you very much for joining us.
And thank you very much for having me.